Hi guys, welcome to Podiatry Practice Mastery. My name is Don Pelto. I am a full-time podiatrist in Worcester, Massachusetts, and I am here to help you with any of your problems in your practice. I have many videos on different aspects of practice management you might enjoy, and also if you put a question underneath any of the videos, I'll try to answer them in a future video. Thanks.
Hey guys, welcome to the weekly update. Don here. I am at my home office today. I want to go over a little bit about leverage, and this is something I want to talk about. So we're not really taught leverage. If you go back to when we were learning in residency, I recently did a lecture for the residents, and they're just so used to doing things by themselves all the time. They just kind of work, and then they see all the patients, they do all the casts, they do all the surgery, and there's really no way to leverage themselves. And this is something I don't think we naturally learn that well. But the thought is, if we want to produce more in our podiatry practice, we have to learn different ways to leverage ourselves. And I've tried different things. You can do different things to leverage yourself. You can, for example, use technology to help leverage yourself. You can use medical assistance to leverage yourself. But I think that the key really to produce more revenue in your practice, it has to be some type of leverage. So you want to leverage, you also want to increase the value and the prices of what you offer. So, for example, if you are treating and you're just every patient is like $80 and you want to increase that, you can see more patients, you can charge more for what you do or do things that cost a little bit more, or you can try to leverage yourself. So let me kind of give you an example. So one thing that we do a lot in our practice is shockwave therapy. And, right now I'm doing all the shockwave that I'm seeing. And there are certain things that I need to do, and I think there's certain things that I don't need to do. So, like in your practice, you're probably not cleaning your own rooms. You're probably not stocking all the supplies. You're probably not doing a lot of these things. And what does that do? Well, that allows you maybe to see more patients, but I'm going to maybe propose it might not be the best thing just to see more patients because we kind of get a little burnt out. But let's say I do 3 to 4 shockwaves a day, okay, on patients. And how can I leverage myself with that? Well, you have to ask, well, what are the things that other people can do? I think this would be a good kind of something you can do on a piece of paper. You take a piece of paper out, you write out in a typical day, what are all the things that you have to do? We have to, evaluate x-rays, we have to probably do injections, you probably have to treat the patients. You don't do your own x-rays usually. You have to kind of make the plan. But I would propose, do you really need to do shockwave, or could you teach someone else to do it? And if you wanted to teach that person, what would you have to have in place to do that? And that's something that I've been thinking about recently, because that's my next leverage point. And I was thinking about this. So let's say I charge $250 per shockwave. So we do radial and focus together, and that's $250. And beyond me not doing those 3 a day, I could get an assistant. Let's say I pay them $20 an hour. Or let's say they get $25, each time they do one, or $25 an hour, or whatever I want to do. But in that one shockwave, so you take 250 times 25, that's 10. So that's a 10-hour day at $25. So if they do one shockwave, they basically pay for their wages and maybe not all the other benefits that go with it. But it also frees you up to see another patient that you would be seeing. And so what I would propose is that if you're doing shockwave and you're charging that much, you could hire an assistant. Now, our problem right now, frankly, is finding assistants. We can't get any assistants. We can't get them to stay. But I'm still working on this idea. So the idea in my mind is if I get one assistant that will stay. And so who am I thinking about using? I'm thinking, can I get maybe, I'm trying to find someone potentially a foreign grad, let's say a foreign medical student, foreign physical therapist, someone that might be on a green card and that would want to stay a long time. That's what I'm kind of working on, and then they could focus on that. So my whole thought is the workflow. We have 3 machines. We have 2 radial and 1 focused. We have 2 different offices. So my thought is we would schedule at one of our offices only in the morning, or let's say Monday, Wednesday, Friday, and the other Tuesday, Thursday. And so this shockwave person would be at all of the shockwave sessions, and because we have, each doctor is doing it now, they would be with us. And so it's kind of like training a resident that when they're with us all the time, I'm going to get more confident. That might take a couple weeks, might take a couple of months. But the other benefit is it would relieve a little bit of the staff time. I know it would occupy one of the rooms, but I think we have enough rooms. We have 6 treatment rooms in each office. It would occupy one of the rooms. My thought is, could that staff person just be responsible for their own shockwave schedule? Meaning they would go bring their patients in, they would get the consent. We would do the shockwave until we feel comfortable, and then we could let that other staff person as we feel comfortable. And we've talked about different things, because I know one of the other doctors, they've thought, well, I'll do the first and the third and let them do the second. That's one way of doing it. The third he likes to do because he tends to do the physical therapy prescription at that time, so you can get an office visit. I would consider what I do is I schedule the shockwaves. And so when I'm scheduling it, I'm also giving them the physical therapy referral at that time. The reason I do that because it takes about 3 weeks to get into physical therapy, and I say I'm going to schedule you for shockwave, the 3 sessions, and I'm going to give you the physical therapy prescription right now. And once you schedule the third one, then you're going to start physical therapy at that time. And so for me, those 3 sessions that they're going to do, they can do those with that other assistant, and then I could be there for the first couple, and I could then see another patient during that time. So not only would it leverage you by doing more like seeing other patients if you have that flow of patients in the office, but it would also free you up because they would be doing the shockwave. The concern I have is, though, a lot of times as I'm doing shockwave, I'm just reaffirming, like, are you wearing your night splint? Are you doing your foam rolling? Are you not taking anti-inflammatories? And so to mitigate that, I've thought about, I'm making up a FAQ, frequently asked questions, that all of the like that could be in the room that they could get, and that would answer a lot of the FAQ. And I also think just when the person is shadowing me, they would get kind of used to those things. But I think having it documented, like this is a new term, I don't think we use this that much in podiatry, but SOP, like a standardized operating procedure, and having that documented and how we do things in each doctor's preference and how they do the shockwave, and kind of showing where the location. I think also in our notes, we're going to have to be a little bit more specific. Like we're going to, the posterior lateral Achilles at the area of the insertion, or proximal to the insertion, things like that. We're going to have to do it. Also, if I'm going to be doing an amnio, a lot of times I'll do 3 sessions of shockwave, and then at the second I'll do an amnio. So that amnio I would be present for. I would do that, but I would let the staff do the shockwave. And I think a lot of it is patient perception. I guess one of the concerns is that the patients are paying a lot of money for it, and so kind of having, seeing that they are getting the value, that we're there in case there's any questions. So that's one way to leverage yourself that I'm working on right now. That would be kind of the next leverage point. Another area of leverage that I've started, I think it's going on 6 months now, is using a virtual scribe. And if I could do it over again, when I kind of got busy, the next thing that I would have added, compared to everything else, would be doing the scribe thing. And his name is Murali, and he's in my pocket all day. So I put him in the phone. There's a phone that's in there, and it's connected via Microsoft Teams. And he has really allowed me to leverage myself. And where it really helps the most is I can be present with my patients. And the way I always introduce him to my patients, I say, I don't like it when I go to the doctor's office and the doctor's typing all the time. That's why I have Morale, so I can give you all of my attention. I can look you in the eye. I can treat you. But what I find what he's really helped me with is he's learned how to do all my notes. My notes are actually better than mine now, because many times a patient would bring up another condition, a no by the way thing, and it would take me longer to document it than it would be to explain how to treat it. My notes are better. He puts in like the medical management templates. He puts in the billing. He puts in orders for LFTs, order for Lamisil. He doesn't sign the prescription, puts the orders in. He has my templates for my surgical booking, so he can surgically book things. He can send out all my patient education information. He communicates with my other staff. He's like part of the team, and so it just makes my life a lot easier using him, and I'm less mentally fatigued. And as I joke, I can get more of these other things that I like to do. Like I can meet with other doctors for like my strategy calls. I can do interviews. I can do videos. There's other downtime activities. But also, I think my production has gone up substantially because I'm more present with the patients, and all I really focus on is doing my presentation for them and developing a plan of care, and he does everything else. So I think a lot of times we maybe decide not to do things because it takes longer to document. So we're not documenting, and we're not thinking, or we're thinking about, oh my goodness, I'm gonna have to document all this. And the documentation doesn't even come into my mind anymore, except when he's gone. Like once in a while he's gone, and then I have to remember how to do everything that I taught him. But anyway, that's what I would recommend, is leveraging yourself. I would like to offer you, if you're listening to this, I'm kind of excited. I have one today. I'm doing it's called a strategy call. I have very limited time. It's usually Wednesdays and Thursdays at 12:30. That's the time that I have available right now for these strategy calls. But if you're interested, I'm going to put a little link under here. I'd love to meet with you and go through kind of a strategy call with you to help you kind of leverage your practice more and implement any of these things that we've talked about. That would be fun. It would help me to learn and have more fodder for doing these videos. But I think also it would help you. So if you're interested in that, please click the link underneath this video. Get a strategy call. It's free. But I have very limited time. So if you want to use my time, and what I would say is, what happens if you say if you're working? Well, just block your patients in that time. Give me your half hour. I guarantee it'll kind of be worth it for you. Okay. Thanks, guys. Until next time.